Illinois is making local responders aware of a new illicit drug mixture, and Narcan will not respond to the mixture. Experts tell Lily Cedardahl how a horse sedative called xylazine is making its way into street drugs. Lily.
Mike, the Illinois Department of Public Health sent a memorandum to Terre Haute EMS about increases in xylazine-related overdose in Illinois.
In December 2018, we started seeing this drug xylazine being mixed or being present in the blood of our deceased, along with fentanyl and the heroin and some other drugs of abuse.
Cook County, Illinois Chief Medical Examiner Pony Arun Kumar says xylazine-related cases continue to increase over the years. She says in 2021, the county had 142 deaths that were associated with xylazine. Arun Kumar says they've already seen quite a few deaths this year as well.
In 2022, from the numbers we've confirmed so far, we've seen 41 deaths already where we're seeing xylazine being mixed with fentanyl. It's mostly fentanyl and fentanyl analogs.
EMS Chief of the Terre Haute Fire Department, Kevin Kuhl, says he first got notice that horse sedatives were being used as a cutting agent this spring. He says this is a deadly cocktail.
We usually see a lot of unique stuff. The xylazine was a surprise.
Although no confirmed xylazine cases have been reported by the Vigo County Coroner's Office, Kuhl says there's been 2 recent instances locally where Narcan was ineffective on an opioid overdose, even at an increased dose. Narcan will not respond to xylazine-related mixtures.
I believe we've only had 2 so far. The very first case where 12 milligrams of Narcan had been given, not only by the police department, but as well as our people.
DEA Special Agent Michael Gannon says xylazine is not always easy to detect as it's not a controlled substance, which he says is concerning.
The problem with that is it's a central nervous system depressant, and it can cause you to have heart failure.
Associate Professor for Equine Studies at St. Mary's of the Woods, Edward Ferguson, says as xylazine is used to make horses unaware of their surroundings to prep for grooming or medical procedures, it's important to realize the harmful effects it could have on a human.
So imagine the blood volume in a horse versus a human, and you put the same amount of that pharmaceutical in their system. It's going to be much more potent than a human.
Managing Director of the Indiana Poison Center, Adam Overberg, says he's seen an increase in calls in recent years concerning harmful additives in street drugs.
Really is kind of the Wild West right now. You cannot reliably know what's in what you're taking.
Now, Overberg encourages everyone to utilize the Poison Center hotline. The number is 800-222-1222 and is available anywhere in the U.S. or its territories and is staffed 24/7.
All right. Thank you so much, Lily, for that report.